Diminishing sexual appetite, often referred to as low libido, is a very common concern for people of all genders and ages. It's rarely due to a single cause and is usually the result of a complex interplay of physical, psychological, and relational factors. Here is a breakdown of the primary reasons, categorized for clarity. 1. Physical and medical causes. These are often the first things to consider and rule out with a healthcare provider. Hormonal changes. Menopause and perimenopause. Decreasing estrogen levels can lead to vaginal dryness and discomfort, which can reduce desire. Lower testosterone, which is also present in females, also plays a key role in libido. Andropause, in men. A gradual decline in testosterone levels with age is a common cause of low libido in men. Thyroid issues. Both an underactive, hypothyroidism, and overactive, hyperthyroidism, thyroid can disrupt libido. Postpartum and breastfeeding. After childbirth, estrogen drops sharply, and prolactin, the milk-producing hormone, rises, which can significantly suppress sexual desire. Medications. Antidepressants, especially SSRIs, well known for their side effect of reducing libido. Hormonal birth control can affect sex hormone-binding globulin, SHBG, levels, which may lower free testosterone and decrease desire in some individuals. Blood pressure medications. Certain beta blockers and other antihypertensives. Other common drugs, including some antipsychotics, anti-seizure medications, and long-term opioid use. Chronic illness and pain. Conditions like diabetes, heart disease, arthritis, cancer, and chronic fatigue can drain energy and focus away from sexual interest. Pain from any condition can be a major deterrent. Lifestyle factors. Poor sleep. Lack of quality sleep lowers energy and disrupts hormone production. Alcohol and drug use. While a little alcohol might lower inhibitions, excessive use is a central nervous system depressant and can impair sexual function and desire. Poor diet and lack of exercise can lead to obesity, cardiovascular problems, and low energy, all of which can negatively impact libido. 2. Psychological and emotional causes. The mind is the most powerful organ for sexual desire, and these factors are extremely common. Stress. This is a major libido killer. High levels of the stress hormone cortisol can directly suppress sex hormones. Financial worries, work pressure, and busy schedules can leave little mental space for desire. Mental health conditions. Depression and anxiety. Both are strongly linked to a loss of interest in pleasurable activities, including sex. Past trauma. A history of sexual, physical, or emotional abuse can have a profound and long-lasting impact on sexual desire and the ability to feel safe and intimate. Body image issues. Feeling insecure or negative about one's body can make a person feel self-conscious and unwilling to engage in sexual activity. Low self-esteem. General feelings of worthlessness or inadequacy can translate into the bedroom. 3. Relationship and social factors. Sexual desire exists in a context, and that context is often a relationship. Relationship problems. Unresolved conflict, poor communication, lack of trust, and built-up resentment are among the most common killers of libido. Lack of emotional intimacy, feeling disconnected from your partner, or like you're just roommates, can make sexual connection feel forced or unappealing. Monotony in sexual routine, boredom and predictability can dampen desire over time. Life stage changes. Parenting. The exhaustion of caring for young children, coupled with a lack of privacy, is a classic libido suppressant. Caring for aging parents. The sandwich generation often faces immense stress and time constraints. A special note on the dual control model. A helpful way to think about libido is the dual control model, developed by researchers at the Kinsey Institute. It suggests that sexual response is like a car with both an accelerator and a brake. The accelerator, sexual excitation, is turned on by turn-ons, erotic thoughts, or attractive partner, physical touch, etc. The brake, sexual inhibition, is sensitive to turn-offs, stress, worry about performance, distraction, body image concerns, etc. Diminished libido isn't always about a weak accelerator. It's often about a brake that is being pressed too hard. Effective treatment involves both adding more gas, example, through fantasy, novelty, and, more importantly, releasing the brake, example, by managing stress, addressing relationship issues. When to seek help. It's a good idea to consult a healthcare provider or a therapist if the low desire is causing you personal distress or straining your relationship. It has come on suddenly. You suspect it's linked to a medication or medical condition. A doctor can check for underlying medical issues, and a qualified sex therapist or couples counselor can be incredibly effective at addressing the psychological and relational components.